please, if this is the first time that you are joining us, put in the chat your email and maybe a little bit about yourself. And with that, I will use the email to let you know about future meetings and the title and the presenter for future meetings. We meet every Friday, the third Friday of every month, noon to 1 Eastern time. And with that, with no further ado, I am pleased to introduce Rumana Saifi. Dr. Saifi and I met almost a year ago. It's a few months ago. It was like in September, but we've been fast and furious on another project that we're doing together. And it is my immense pleasure to turn things over to Dr. Saifi now. Rumana, would you like people to ask questions as we go, or do you want them to save the questions for the end?
I'm happy either way, Loretta, Dr. Loretta. Either way, the audience is happy. I'm happy to answer, and they can stop me anytime they would like. Yeah.
Great, thank you. And with no further ado, I'm turning it over to you, Rumana, to start your talk.
Thank you so much, Dr. Loretta, for the warm introduction. I'm Rumana from Universiti Malaya, Kuala Lumpur, Malaysia. And I'll be talking about Photovoice, a qualitative research technique that we have used as a part of an umbrella project on stigma reduction among Malaysian clinicians. So Photovoice was a sub-project under the umbrella project. Now, stigma is a global barrier to HIV testing, prevention, and linkage to care. And there are many forms of clinicians' stigma, stereotype, prejudice, discrimination. The situation gets even more tricky for Malaysia, a predominantly Muslim country, a lower middle income country where drug use is criminalized, same-sex behavior is criminalized, and cross-dressing is criminalized. So I'll just highlight some of the data in order to give like a sort of background to our umbrella project. So stigma among Malaysian clinicians have been reported in the existing literature towards the key population group affected by HIV. And that includes MSM, PWID, transgender, female sex worker. And if we compare the key population affected by HIV with the general population, the range, the rates of HIV, it ranges from 15 to 54 times higher in comparison with the general population. And access to HIV care is very less. And just to add to this, in Malaysia, HIV epidemic is concentrated among the key population group, that is MSM, PWID, transgender, and female sex worker. So in the bigger project, in the umbrella project, we tried to implement stigma reduction tool, and we used a teletraining platform, Project Echo, and through this online platform, we brought in Malaysian clinicians, and we implemented the stigma reduction tools with a bigger objective of reducing clinician stigma towards key population group. And Photovoice was one of the components in this bigger project. And we used Photovoice as a tool in order to understand the perception of key population group and people living with HIV. Perception of key population group towards the clinicians in Malaysia. Yes, our short-term objective was to incorporate stigma reduction tool into Project ECHO, and we pilot tested this intervention. This is the project team. It was a collaborative project. University of Delaware, Yale University, and University of Malaya participated in this research project, sponsored by NIH. Now, a little bit of background around stigma intervention toolkit. As per existing studies, any intervention on stigma reduction, it has to be multi-level, multi-component, and longitudinal, which means that a single session on stigma really doesn't help to reduce stigma, be it community or be it clinicians. And the other important part here is like multi-component. There is no single tool that can eliminate stigma. And in our umbrella project, we used various components, and I'll be focusing on only Photovoice today. So then the project structure was like we implemented Photovoice project with the key population group and people living with HIV. There were other components also, like we involved the clinicians for an online focus group discussion, and we pre-tested the intervention protocol. So far, in most of the stigma interventions, what's been done, it's like one clinic usually was taken into account, and it was short in duration, and very few stigma reduction tools were taken into consideration. And it was like single level intervention. However, in the stigma project that we just completed, we involved multiple clinics because we used online teletraining platform. The intervention continued over a period of 9 months, and we had multiple stigma reduction tools. One of them was Photovoice. This is Project ECHO, as it's like a teletraining platform. So we were able to bring in clinicians across Malaysia, across different states of Malaysia, and we were able to share the Photovoice project through this online teletraining platform. So phase 1 was the Photovoice phase, and we enrolled 35 key population, 35 members of the key population group and people living with HIV. So Photovoice is, of course, it's a qualitative research method which features photographs and stories. Traditional data collection method, we used photos here in order to understand the perception of key population groups towards clinicians, and it's action oriented. And Photovoice actually helps to answer descriptive research question. And most importantly, Photovoice has the potential to bridge the gap between researchers and policymakers. And why not? Because a picture is worth 1,000 words. So for me, like I was involved in this project, and the entire project period was around 3 years. So we involved photography and storytelling. So it was a very versatile data collection method, and it was culturally sensitive and very context specific. And we could understand communities' needs and assets and their perceptions through Photovoice. And it doesn't require like, we didn't have like the participants who represented the lower socioeconomic strata could also express themselves by using photographs and narratives. I'll be sharing the photographs and narratives with all of you very soon. So this is how the Photovoice project looks like. By that, I mean, this is one example of the various pictures that the research participants took. So we had 6 questions that we asked the participants, and they answered to the question with a small narrative and with a photograph. So here the question was like, how do doctors see you? And the research participant here was person who inject drugs. We didn't edit any of the caption that was written by the research participants. So here the research participants said that doctor's view of me, I'm an active and stubborn person. And in order to express this caption, the participant used this photograph. Now, if we look at the literature, Photovoice was introduced in the 90s, but over the years, it gained popularity in HIV research. And you can see like number of scholarly publication referring to HIV Photovoice from 2012 to 2021. However, in other fields, Photovoice was used more frequently than it was used in HIV research. So this is how, this is the first step on how to conduct a traditional Photovoice in-person, synchronous project. So usually like the training for the Photovoice involving the research participants, it's usually in person and synchronous, where the participants gain photography skills, understand research methods, ethics, with a bit of understanding of social power. And then after the training, research participants, they go back to the community, take photographs, and submit their photographs. And researchers review the photographs, discuss with the participants, and then share the photographs with the community and policymakers and relevant stakeholders. So this is the traditional way of conducting a Photovoice project. However, we conducted our Photovoice project during the pandemic time, and we transitioned to online asynchronous method from synchronous method. And it seemed very feasible because 80 to 90% of Malaysian population owns a smartphone. So rather than putting a camera in the hands of the research participants, we made use of the smartphones that they possess in order to conduct the online asynchronous focus group discussion. And as there is substantial stigma around representatives of the key population group, so asynchronous online method looked very feasible. And at the end, when we assessed the strengths and weaknesses of online asynchronous focus group discussion, and the research participants were very enthusiastic and were very positive about this data collection method. And also, like, transportation is often a barrier, like geographical location is often a barrier for many of the research method. So online asynchronous focus Photovoice method had the potential to overcome this barrier. And there are evidence in literature that how online asynchronous Photovoice tool can be very effective, especially in vulnerable population. And there was evidence of an online Photovoice project, and it was acceptable and feasible among American youth. So it was a three-phase project. So we created a website, and the website hosted the Photovoice project. The second phase was data collection, and the third phase was all the photographs that were submitted by the participants. The third phase was like a submission review of those photographs. So in the first phase, we created a website to host the project and to facilitate the data collection. And the training was given through this website. And we collected data, and participants submitted data in this website. The data was anonymous, and we followed the HIPAA guideline. After all of the submissions were done, the research team reviewed submission to ensure confidentiality. And I would like to emphasize on the point that this method also gave an opportunity to empower our research participants, because when we trained the participants about the photographs, some skills around photography, about the website, they felt empowered. And it seemed that there was a sense of ownership among the research participants about this project. So how did we do the submission review? Of course, we followed the HIPAA guideline, and we didn't include any identifier in the photograph. There were photographs with identifiers, and we tried to edit those photographs in consultation with the research participants. And the pictures that we couldn't edit with identifiers, we excluded those from our project. So this is how we created the website. There was a video, And in the video, we invited the infectious diseases specialists in Malaysia to explain the Photovoice project to the research participants. And we had 6 questions, like 6 themes, and participants responded to those 6 themes by taking pictures and putting a caption. So the 6 questions was, they were like, what makes you happy? What makes you sad? What is important to you? What challenges do you face? How do doctors see you? And what would you like doctors to know about you? And regarding the photography skills, we had a professional photographer enlisted by the National Geography, who taught the participants about the color, about the composition of the on how to take pictures. So there was also a skill building component under the Photovoice project. So the welcome video, it was conducted by the infectious diseases physicians in Malaysia. And this is John Cox, the professional photographer, who trained the participants on photographic skills. And how did we recruit the participants? So we, as you know, that same-sex behavior and also drug use, it's criminalized in a Malaysian context. So we reached out to the community-based organizations, and we recruited participants with the help of the community-based organizations. At the end of the Photovoice project, we assessed acceptability and feasibility of conducting online asynchronous Photovoice project from the key population group. And these are some of the results. And I would like to highlight, like, the participants were very positive about about expressing themselves through online asynchronous Photovoice project. So we had around 35 participants, and there were 204 Photovoice submission. And then we screened, and at the end, we had around 200 photos. And we had all of the members of the key population group affected by HIV, and also people living with HIV who submitted photographs with a caption. And these are some of the quotes by the research participants. It says that I love it because it gives me the opportunity. Just opportunity to convey my heart and words through pictures in a unique way. Unlike an ordinary survey, the Photovoice allows participants to do something fun. And as I have mentioned, Photovoice was conducted during the pandemic time. And I think it gave an opportunity to the participants to ventilate themselves through the pictures that they took. And they have also mentioned that it gives them like a feeling of empowerment when they took these photos and submitted those photos. We received both positive and negative responses from the participants, both positive and negative perceptions from the participants towards clinicians. So this photo was taken by a female sex worker, and she responded to the question, how do doctors see you? So she took this photo, and this was the narrative. Even though I am a sex worker, the doctor I visit still treats me like other human beings, even though I do activities that are outside the norms of other human beings, and the doctor feels that I should be treated like other human beings. The next photo that I'm going to show you, it this one says something very positive, but if you look at this photo, this was taken by a man who has sex with men. And when we asked that, how do doctors see you? So he took this photo, and the answer was, I feel like doctors see me as not normal, or one may called a freak. Even went to a clinic to get myself tested so I can know my status. The doctors were shocked and look at me weirdly. So this photo was taken by a transgender, and the caption says, as a trans woman, we face a lot of stigma and discrimination from the society. Since we are visible, some people tend to hurt and bully us. So we need protection, like how this grill protect the house, but who's gonna protect us? As I have mentioned that in Malaysian setting, cross-dressing is criminalized. Something is wrong here. I can't move my slide.
I don't have the PowerPoint. I've got a different version right now, so.
We could try unsharing and sharing again.
Okay.
Could that work?
Yeah, it's working now.
Okay.
Sorry.
It's working, yeah. So this was a photograph that was taken by, again, a transgender, and the question we asked, it was, how do doctors see you? And the transgender participant responded to this question by using this photograph, and saying that even though I'm a trans woman, but my ID card identify myself as man. So most of healthcare workers see me as man. This is not what I want or identify. I just hope I could be the branch from the picture, which is genderless. Now, just to let you know, again, we didn't edit any of the captions. The grammatic, it's just the way they expressed themselves in a local language, and they translated it to English. This was from a man who has sex with a man, and the question was, what makes you sad? The mask that I have to wear when I approach new people, or forced to wear by society. People expect me to wear a certain mask to blend in with the norm. It saddens me that I have to hide who am I, even when I have been through a lot to take it off. This was again by a transgender. What do you want doctors to know about you? I just hope the doctors treat me as women and equally with other patients without any stigma or discrimination. I just want to be healthy and peaceful, like the nature in the picture. This was from a person with HIV. So the question was again, what do you want the doctors to know about you? I want the doctors to know about me that I'm strong, but there are times when I get scared, when I face the limitation of this disease, where I need the support of medical knowledge in terms of facts and moral support. And this was from an MSM. I want doctors to know that I want to be free of being myself around them, to spread my wings and share my experiences with them. So after we received all of the photographs, we compiled them to small videos, like there were 6 videos. Each of the videos focused on each of the key population groups. And then we shared those with the community-based organization and also posted those in different websites in order to let the people know and reach out to the policy makers. So I'll just share one of the YouTube videos now. It's about the transgender.
As part of the Photovoice in healthcare study.
Can you see?
34 members of
Can you see the video?
No.
Can you see?
What makes them happy and sad?
You have to share your monitor instead of the actual slides. Oh, there it is.
Yeah, I can see it.
Answer questions, photographs, and captions.
So it's in Bahasa Malayu, the local language, and then the voiceover is in English. Yeah.
I'm a performer. Who is the performer? I love to see people and dancing to them. Some makeup, costumes, always make me enjoy the moment. It's always happy. Surrounded by beautiful nature and flowers, happy. Lotus flower is one of my favorite flowers. I feel myself as a blue flower who got the freedom to live as a trans woman and surrounded by green leaves. Means good luck, money, and health, which is absolutely necessary to my life. It is my doll, Chilakuti. I always treat him as my son. Whenever I look at him, I feel very sad because as a trans woman, I do not have the rights to marry a man or adopt a child legally in Malaysia. Hope this will change in the future. Normally, when I read the Holy Al-Quran and perform prayers to praise him, will always make me sad. I am very apprehensive about doing the HIV screening. Malaysians in general are still lack of information regarding HIV/AIDS, which lead to stigma and discrimination. Life is not fair for transgender women. We are still living under stigma, discrimination, and gender equality. Some of the doctors see me as someone who committed sin, and I should repent, be as I should be. I would like to take this opportunity to educate doctors in Malaysia, address us as a women, and we prefer that we no longer wear the man mask. We are living in a free country that behind the man mask, we transgender women, just another type of women, We are no longer hide our identity. We prefer world call us women.
I'm just trying to go back to my original presentation. Oops. Okay, actually, I have come almost to the end of my presentation. We did a photo exhibition actually of all of the photos that we had. And to me, that was like one of the very important component of this project, like sharing what we gathered from the community with the community during World AIDS Day. And
Rumana, do you want
yes.
me to share my screen of the slides? I've got it now.
Yeah, just the last two slides. Yeah, I'm facing some problems here.
That's fine. I can share. You're just going to need to tell me where to go. Can everybody see it? Now I'm having a problem with the size. Which ones did? Which?
At the last. Yes, this one. So this is the exhibition, the Photovoice. Can you all see the slide?
Yes, we
We
can.
can see it.
Yeah.
Yep.
So this is a glimpse of the Photovoice exhibition that we organized at Universiti Malaya Hospital on World AIDS Day. And I would just like to share a small story here. So it was like we set up everything just the day before the exhibition. And I don't know what, during the exhibition, I mean, on that day, when we reached the venue early in the morning, all of the photographs and the captions, everything was on the floor. I don't know like how or who did that, but we set it up the day before, and on that day, it was like everything was on the floor. So we recreated the exhibition again, and we could present all of the photos to the audience on that day. Loretta, the last slide. So the key message here is Photovoice can be considered as a user-friendly, versatile data collection technique, and it can foster ownership and empowerment. Because when we train someone, give someone some skills and ask them to express themselves, there is a feeling of ownership and empowerment, and it can reach people from all walks of life. And it has huge potential to appeal to the local community. So with that, I'll end my presentation. Thank you so much for the very patient hearing.
That was wonderful, Dr. Rumana. And I was struck by how creative your participants were in understanding the limitations of confidentiality and using some other way to express, to provide a visual for what they wanted to express. I think that that requires, I guess, some training, which I really never really thought about as much before, but it is important to give your participants some kind of understanding of what it is to do research and confidentiality and the ethics involved in this kind of work. Are there, yeah, somebody said something about the ruining your World AIDS Day presentation, and I think it really speaks to what is the situation in Malaysia, where there are such strong feelings and there is so much in terms of backlash against these different populations. That is part of basically these individuals' daily lives. So this is a very wonderful thing. Now, did you provide the videos to clinicians in training sessions separate from what you put up on the web?
Yes. So there were around 6 videos, and due to time limitation, I couldn't share all of the videos today. And we provided the clinicians with all of the videos. Yes, we did.
Very good. There's a question in the chat box about, first of all, it's a wonderful project, but that were the participants present at the World AIDS Day presentation. I want to hop on that question and extend it a little bit further in that your review or selection, I can imagine you did not use all the photos that were submitted, but maybe you did. Were the participants or members of the communities part of the review of which photos to include, which photos and quotes to include?
Yes, very, very good question. So yes, we invited the participants on World AIDS Day and they were present. Although it's anonymous, and often I have seen like members of the key population groups, they're not very keen coming to the university. But we had representation from the key population group. And yes, when we deleted some of the photos, yes, the participants were part of the review process. So we had 2 local consultants, and both of them participated in the research projects, and they were member of the key population group.
Thank you. Another question from the chat is, how did you work to ensure that the participants stayed on topic with the Photovoice submissions? We all can get a little tangential at times.
Yes. So we had a research coordinator who was in touch with the participants throughout the Photovoice project, and there was always consultation, counseling, in order to make sure that we comply with the ethics guideline, as well as we listen to the voice of the participants.
Excellent. Another question is, what suggestions do you have for researchers and community collaborators who want to do Photovoice projects in settings and countries where the law is criminalizing these behaviors and identities? How do you deal with it? Well, you dealt with it in Malaysia, but what would you suggest to other researchers in other countries and communities?
Yes, so I would suggest to work very closely with the community By that, I mean reaching out to the community-based organization, going to the people at the grassroots level, and design the project in such a way so that the participants feel ownership and they feel empowered in order to participate in the project.
Yeah.
Community engagement with the community would be the key. Yes, because top-down approach, it really doesn't work, especially when it comes to community-based research. So engagement with the community and building rapport with the community, yes, should be the very first step.
That's very powerful and good to know. I'm going to add on to that question of what do you as a researcher who's been in this work for a good amount of time, my feeling is often when you are going into certainly marginalized communities and you're engaging for the first time with them, how much time, this is not a hard and fast rule that I'm asking of you, but how much time and what strategies would you use for building that trust and that relationship with whatever community you're going into? How much time does it take, and what do you do to foster or optimize being accepted by the community to do this research?
I would say, Dr. Loretta, the first step is being honest and sincere to the community. And I have never made any empty promises to the community. In my years of working, I have never, ever made any empty promises. And honesty and sincerity, that's all it takes to create a successful project.
But the other part of the question is, what kind of time do you think you need to put in upfront?
Yeah.
And what strategies can you use beyond being honest and transparent to the community to optimize your ability to work within that community?
Yeah. So one of the issues that I would like to highlight here, it takes time, but often we don't have that much time, right? To build the trust of the community. Then we design the project, we conduct data collection. I would say that, visit the community as often as you can without disrupting their work. I always tell my students that if you want to work with the sex workers, you need to go to them rather than expecting like they will come to you without disrupting their work. Like if sex workers are your end users of any intervention, then work with them during night time, because that's when the sex industry operates. Yeah, so you have to fit into their shoes rather than making them fit into your shoes. And usually when I go to the community, I always try to understand like their language, the lingos, and sometimes I eat with them. If they're sitting on the floor, I sit on the floor as well. I don't tend to establish that hierarchy between a community member and a researcher. And the venue, I always try to select the venue as per their choice. I never invite them to come to the university if they don't like to. I go to them rather than expecting that they will come to me and I will sit in my air-conditioned room and interview them. Yeah.
Well, I'm sure members of the audience are picking up on how warm and genuine Dr. Rumana is in everything she does, or at least everything that I've seen her do. Yes, she brings that humanity to it. There was another question about in countries or in cultures where some of these behaviors are criminalized. In your study, did you find that the participants expressed their anxiety, their worry about participating in this project?
Yes, yes. So
The follow-on question is, so what did you do to deal with that?
yes. So usually, like in such cases, of course, participants will have that anxiety. But then the privacy and confidentiality part, I always take time to explain all of the privacy and confidentiality issues to the participant. And the consent process, like the voluntariness of participating in the study, I always take time to explain them these parts, like voluntariness, privacy, confidentiality. And I always emphasize on the point that they can leave the study anytime they want. Even if they're enrolled in the study, they're allowed to leave the study anytime they want. And the other thing is, when I talk about voluntariness, privacy, confidentiality, I try to be as simple as possible. I never bring in like the ethical jargons like Belmont Principle, never, yeah. I try to be as simple as possible, and that works.
Yes, thank you. Some other questions that I had. First of all, I was curious in the larger study, what was the purpose of and why focus groups with clinicians? What was the purpose of that aspect of the study?
Yes, so we conducted focus group discussion in order to get the views of the clinicians, because like any stigma reduction intervention, it's like multi-level. So we tried to understand views of the clinician, not really towards the key population group, but their views. We tried to gather their views around Project ECHO, like the timing of Project ECHO. How should we conduct Project ECHO? Because it involved clinicians, like the teletraining platform, through which we delivered the stigma reduction tools. So when we were designing Project ECHO, we involved clinicians as well. That was more because we wanted to know their views and how Project ECHO will work for them. Because clinicians are busy, and we brought them in like online. It was an online platform, but they were with us for 9 months. So we designed ECHO in such a way so that reflects clinicians' convenience. Yeah.
And one last question from the group was about, is there resources from Project ECHO that are available to other researchers or, to anybody?
Yes, yes. There are a lot of resources, videos that are available. And just to let you know, Universiti Malaya is a site for Project ECHO. So there is a established website on Project ECHO, and I think around 30 countries around the world, they have ECHO. And Universiti Malaya is one of the partner sites, and we have a lot of resources around ECHO. It's available online, but I can also compile and share with all of you. Yeah.
All right, if you would do that, I was looking at Project ECHO. I was trying to find the link to give people the resource, but if you could compile or send that information, I will be sure to send it out to everybody who gave me an email or who I have an email for. I will send it out once I receive it from you.
Yeah, I can do that. Definitely.
Okay, thank you. Thank you so much. This was an amazing presentation. I think there was a lot of enthusiasm about using this method and the power that it has to reach all sorts of different kinds of people, policymakers, clinicians, service providers, and the community. It gives them a voice, which is really what it's supposed to be there for. Well, I wish you all a very happy, fun weekend. And thank you so much, Dr. Rumana, for staying up so late to join us for our meeting today. With that, I will end the session and see you next month.
Thank you.
Thank you so much.